Hello. ECG interpretation is stepwise. Step one. Step one is simple, but it is one of the most important parts of the ECG interpretation, confirming the basics. Before analyzing any waves or intervals, make sure the ECG you are looking at actually belongs to the correct patient. Start with the patient's name, patient's age, and sex. Age and sex influence normal ECG values. For example, pediatric ECGs have different normal limits, and elderly patients often have baseline conduction changes. Next, check the date and time of recording. This helps you decide whether you are looking at an acute event or comparing to a previous ECG for changes. Then identify the clinical indications. Why was this ECG done? Chest pain, palpitation, syncope, pre-operative screening, or just a routine check. This context will guide your interpretation and help avoid over-reading normal variants. Now look at technical settings. First of all, the calibration. As mentioned on the screen, calibration shows us whether an ECG machine is set correctly. So calibration is often upright, guys. And the standard calibration is 10 millimeters equal to 1 millivolt. Shows as a small rectangular spike at the beginning of the ECG or at the end of the ECG. Next is the paper speed should be 25 millimeters per second. These are the default settings. If altered, for example, 50 millimeter seconds or a calibration of 5 millimeter per millivolt, the ECG may appear abnormal, stretched, or compressed, leading to serious interpretation errors. Finally, check for artifacts such as tremor, loose leads, or electrical interference. A noisy ECG can mimic arrhythmias, segmented changes, or conduction abnormalities. So remember, before interpreting the heart, always verify the basics. This step protects you from misdiagnosis and ensures that everything you analyze afterward is accurate and meaningful.